In this video, we will be discussing the link between our stored trauma and our future health. Jess Thompson, our clinical director, joins me today to discuss how trauma can be a catalyst for physical illness. Now, it's very true to say that trauma can elicit a meaningful impact, not just on our mind, behavioural patterns, sense of self, but also on our physical body and our biochemistry. These physical impacts of trauma might present as gastrointestinal symptoms, for example, due to changes in the diversity of our gut microbiome as a consequence of traumatic experience. Or we might experience fatigue. Studies suggest that severe trauma, early life adversity, and stress may all negatively impact the structure and function of our energy-producing mitochondrial cells. We might even experience cognitive symptoms. Research indicates that trauma directly impacts on areas of the brain such as the hippocampus, amygdala, and prefrontal cortex. And trauma and associated stress may also impact on our sleep quality, our hormone balance, and even the health of our vagus nerve. And finally, we might even see an increased sensitivity to foods and supplements as a consequence of the maladaptive stress response that results from trauma.
You can see how in combination then, how and why trauma can ultimately impact on our physical well-being.
Yeah. The ACE study also suggests a link between childhood trauma and the development of adult chronic disease, and that includes autoimmune conditions, diabetes, heart disease, and chronic pain syndrome, in addition to more social and emotional concerns such as PTSD, depression, and even drug and alcohol misuse. So consequently then, when trauma is a facet of a case here in the clinic, it's essential that we combine our therapeutic coaching approaches with our nutritional therapy tools in order to achieve meaningful progress, working to support both the body and the mind. So following years of working with trauma clients, Jess, you developed one of our newest programs, which is our Reset program for trauma. I wonder if you could share with us a little more about that program.
So I've been a trauma therapist for many years, and here at the Optimum Health Clinic, we've created a program with the key ingredients needed to heal from trauma. The Reset program for Trauma 1-to-1 is designed to meet the needs of both those who've experienced traumatic events with the consequent nervous system dysregulation, and those whose childhood lacked the safety, boundaries and love needed for developing robust health and psychological well-being. The course provides the psychoeducation, tools and strategies needed for the initial phase of the journey, which is the preparation and stabilisation phase. We use the analogy of a house to help explain the sequence and timing of the different parts of the intervention. So if you imagine yourself as a house that's withstood some stormy weather and needs some attention, before diving into mending the house, scaffolding needs to be put up and the foundations need to be secured. In this analogy, the scaffolding is created by the tools and understanding provided by the Reset program for trauma, which you're guided through by your therapeutic coach. And the foundations are based around developing an internal felt sense of safety, the ability to have boundaries, and working on a compassionate connection to self. Once the house is scaffolded and stabilised and the foundations are secured, then with the help of your therapeutic coach, you'll begin the deeper work of processing the trauma. In my experience, it's the stabilisation and preparation phase that's absolutely crucial before attending to the trauma. A person needs to feel well-resourced and supported in order to effectively process their most challenging life events. This stage takes time and a constellation of daily practices, which you'll be doing in between sessions.
And I know it's going to be a common question, but how does the program itself attend to the individual's needs and their personal experience of trauma?
Yeah, absolutely. Here at the Optimum Health Clinic, we provide a tailored, individualised approach and have several methods for processing trauma, which we use flexibly depending on the needs of the client. For the stabilisation phase, we draw upon approaches from neuro-linguistic programming and emotional freedom technique, and also weave in aspects of eye movement desensitisation and reprocessing in terms of resourcing and preparing the foundations needed. The therapeutic coach will assess which trauma processing methods are most appropriate for each case, and it will always be a combination of thought level, emotional level and somatic approaches, as in order to heal, we need to address all three of these areas. For some people, the 4.5 hours of one-to-one sessions, combined with the enormous resource within the Reset programme for trauma, is actually sufficient to address the dysregulation of the nervous system caused by trauma. For others, further sessions are required, and this will be assessed and discussed with each client to ensure they have the right level of support.
Jess, thank you. If you would like to know more about the Reset programme for trauma, you can visit our website via the link in the box below and arrange a free discovery call. Or you can order one of our information packs to give you more detail about exactly what it is that we do here at the clinic. We look forward to hearing from you.